And so I think we should just go ahead and have everybody on the screen introduce themselves. And then just in terms of what we are gonna the email that he sent. What happened? There we go. that he sent out. What we're trying to do today is see if we can agree on the projects and services that the advisory council forwarded to us so that we can move forward with a submittal on some recommendations, advisory board, operations board, I guess it was, to submit our first 2-year plan. And Robin and others are going to walk us through that process with the really great tool that was sent with the materials. So that's the extent of the intro that I want to do here, so we can get down to work. But I'm just going to call names because in the order you're on my screen, and just ask you to say who you are and who you work for and why you're here. So Robin, we'll hear a lot from you later, but go ahead.
Hi, everybody. Robin Bohannon. I'm the director of Boulder County Community Services, and our staff team is supporting this effort.
Yeah, and Kelly.
Hi, everyone. Kelly Veit. I'm the program manager for the Behavioral Health Hub out of Boulder County Community Services. So I work with Jim and Lisa, Marcy, and Tucker, the members of the behavioral health team, in helping to stand up some of the work with the opioid operations group.
Great, thanks. Sheriff?
Hi, Joe Pelley, County Sheriff.
Tucker?
Hi, everybody. My name's Tucker Yerman. I use he, his pronouns. I'm a member of the behavioral health planning team and one of the Boulder County staff members that have been supporting the opioid operations board.
Great, thank you. Nuria?
Hi, everyone. I'm Nuria Rivera Vandermeide. I'm the city manager for the city of Boulder.
Thank you. Miranda?
Miranda Fisher, town administrator for the town of Netherland.
Susan?
Hi, everyone. Good to see you all. I'm Susan Caskey. I'm the Director for Housing and Human Services with Boulder County.
Lisa?
Hi, everyone. I'm Lisa Moreno, she, her, ella. And I am Behavioral Health Strategic Planner within Strategic Initiatives under Robin Bohannon at Community Services.
Mandy?
Yeah, it's actually Anjali, and I don't know how
I'm so sorry.
No, please, no apologies needed. I'm Anjali Nandi, the Chief Probation Officer with the 20th Judicial District.
Oh, I think I've met you at our Criminal Justice Advisory Board meetings. Jim?
Good afternoon, Jim Adamsberger with Community Services Department, and I provide support to the opioid team.
Thank you. Elizabeth?
Hi, good afternoon. Elizabeth Crow, Deputy Director of City Boulder Housing Human Services. I'm just here to support Nuria. Thanks.
Thank you. Lexi?
Hi, everyone. Lexi Nolan, Acting Director at Boulder County Public Health. I apologize for not being on the screen. I'm in a car, but I should be home soon.
Okay, thank you. And Judge Bakke?
Yeah, hi, same as Lexi. Judge Bakke here. Thank you for having me, and no video. I should be in a car here soon. I have to get to another meeting in a bit.
Okay, thank you. I think that's everybody.
Harold has joined us.
Okay, great. Yeah, everybody changed on my screen. So Harold, we're just doing quick intros, who we are and where we're from.
Okay. Is it my turn?
Yeah.
Yeah, Harold Dominguez, City Manager of Longmont.
Okay, did I miss anybody? I don't think so. All right, so Robin and Kelly are gonna lead us through the discussion of the project list. So I'll turn it over to them.
And Robin, just let me know when you want me to share the presentation.
Go ahead, Kelly. You can put it
okay.
Up. This is mostly going to be the Kelly show, so.
All right, there you go.
All right, so Commissioner Levy really shared the goal of the meeting and the outcome that we hope to get to. And I just want to remind everybody, especially for if there are any members of the public on our meeting, just some guidelines we have about virtual meetings. So this is not intended to be a public hearing, which means we will not be taking public comment or having interaction with the public. And for stakeholders and members of the public who are not regional council members or presenting staff, please mute your microphones and turn your cameras off. And while you may choose to make comments in the chat, the comments will not be part of the public record and will not be followed up on by staff. So we've done the welcome and introductions, gotten through some technical difficulties. Thanks to Barb Halpin for helping us transition from Teams onto Zoom. And I'm going to hand it over, Kelly, to you to begin the discussion about the Shovel Ready program recommendations.
Thank you, Robin. So we did want to start with just a little bit of a recap from September. We know that it was our inaugural meeting of the council. And so we threw a lot of information at you all and wanted to sort of reground ourselves in what we sort of accomplished in that discussion and where we left off, which is really where we're beginning today with the review of the Shovel Ready programs that we put forth as recommendations. So in terms of what we went over in September, we did provide you a little bit of background information. We talked about, what are we seeing in our community in terms of impact from the opioid epidemic, talking about the landscape analysis exercise that the Opioid Operations Board did and some other quantitative data. Also talking about some of the foundational structures that have been put forth from the state to really guide the allocation process. So the Memorandum of Understanding from the Attorney General's office, which also outlined the approved purpose areas, those 5 areas that are eligible for funding, which you've heard us talk a lot about so far. We also talked about the work of the Operations Board. Our Opioid Operations Committee has been working since May, meeting bi-monthly from May to September to really both gather shovel-ready programs for those initial recommendations and then really review sort of the criteria against which we were rating some of those programs. Had a few exercises dedicated to our understanding of priority areas across those 5 approved purpose areas, and then dedicated particular funding amounts that were in alignment with the prioritization of those 5 areas. So a lot of sort of methodology and process from that board to go into developing the recommendations that we also spent time introducing to you in September. So we did talk to you about what our proposed project areas are and the allocation amounts. And then we gave a little bit of homework in the closing of that discussion, which was really our supplemental materials that listed out the allocation amounts, the projects that we're putting forward, and then a little bit of an ask from council members to review that and come up with, a yay or nay. So are we approving, or are there any blocking concerns that council members want to bring forth today? So that's sort of where we got and where we are today. So our main exercise for today is to review the shovel-ready recommendations that were provided to you, intro to you in the September meeting, and then provided to you in more robust format after that meeting. An exercise for today, and this was outlined in the materials that went out to you in Tuesday's meeting reminder, but really this is our primary charge of today, is to determine if those recommended programs are at a place where we feel comfortable submitting them to the Attorney General to release funds to our region. And so the process that we're going to sort of go through is, first we're going to look at each of those project areas. They're broken down in the same way that you received them in that supplemental information packet. So there's a table for the treatment programs, the prevention programs, and the additional area programs. And again, those 3 categories are really the approved use categories that are reflected in the cost system that we talked about. So the question there as we go through those is really determining if you have significant concerns about any of the projects on the list, or if there are critical projects that are missing that you would like to propose adding into the mix. We're also going to review the allocation amounts by each of those approved use areas, again, treatment, prevention, and additional areas, and seeing if you would recommend any changes to those allocation amounts and identifying if you do have any blocking concerns to approving those allocations. This is a reminder that we're going to probably come back to a few times today. We are not needing to approve the dollar amounts that are going to particular programs today. So really, in order for us to draw down funding from the state, what we need to do is just approve our allocation amounts at that approved use area, those 3 categories noted above. So not yet the project area. We will have additional time and process in place to confirm that the allocation amounts going to particular projects is really what we want to see. So before we go into our exercise, I did want to do a little bit of a reorientation to the information packet that was sent out to you all after our September meeting. This is sort of the table breakdown that you'll see here today. So the green header is, again, that approved use section. Over to the left is the approved use area. So we kind of think of that as like a subcategory within the approved use section. And again, that's how that's reflected in a drop-down sort of categorization of the cost system. So the body of the actual table shows the program name and of course the owner who put forward that, that recommendation or that program. And then over to the right, you can see our totals. So the section total, so that top bubble, that shows the 125,000 amount. That's really what we're working to approve today, that allocation. The corresponding allocation amounts to each of the programs is, again, something we'll leave for a later discussion. This is just another piece of the packet that you all received, and this is sort of the level that we're going to go through these projects at today. This breaks down those recommendations and provides a little bit more description. So hoping that council members had an opportunity to read through and think, you know, if there's any blocking concerns about any of these programs. I'm throwing this back up as promised. Just a reminder of exactly what we're trying to approve today is just those allocation amounts to the treatment, prevention, and additional areas categories, and not yet the project areas. All right, so let's dive into our actual exercise. So we want to start with a reminder of the funds that we're working with. So our total for year 1 funds comes to $1,656,360. The way that we broke this down, and again, this was a process that a prioritization process that our opioid operations group took on, was $200,000 allocated to recovery programs, $310,000 allocated to harm reduction programs, $297,547 dedicated to prevention and education, $308,642 dedicated to criminal justice, and $540,169 dedicated to treatment. So that said, I'm going to pause and give you a little idea of the process here. I know these slides are dense, so bear with me. I'll walk us through these and just sort of, you know, give a high level summary of the program description. So, you know, give your eyes a little bit of a break from trying to read through it with me. I will go through these one section at a time. So I'll pause after the treatment section and ask any blocking questions, concerns, etc. And I'll do the same for prevention and then the other purposes area. And then again, at the end, we'll have additional time to just sort of review as a whole and see if there's other questions, concerns, comments. So starting with our treatment programs, I'm going to go ahead and minimize my Zoom speaker panel so I can see my full slide here. So starting with our treatment programs, the first up was the jail MAP program. And really this was the program description is to sustain the delivery of medication assisted treatment that's currently offered in the jail. So there is insufficient funding to continue the program for the full year. The jail MAT program is comprehensive. It offers assessment, planning, individual and group therapy. So one thing I will also point out, should have done this at the beginning there, but so we have a new column that was additional. It was not reflected in the original supplemental package that went out to council members, but we did want to show how the original 5 approved purpose areas were folded into the 3 approved use areas. So over on the right, that original approved purpose area is just where this program originally was categorized when we were working across that spectrum of 5 approved purpose areas. So our next treatment program is the COPE program, the county's comprehensive opioid abuse program. This is offered by Community Justice Services in the jail. It partners with the MAT program above to provide medication-assisted treatment and support or treatment support to the medication component. This is an existing program that provides case management to opioid users. The Rewind program. This proposition was to, or excuse me, this proposal was to expand the City of Longmont's Rewind program by adding an additional bilingual FTE licensed addiction counselor. This is a program for youth that have been charged with violating a Longmont municipal ordinance. Rewind specializes in meeting the needs of youth with mental health and substance use concerns. The goal is to address delinquent behavior informally in the community to prevent subsequent offending. The LEAD program. Did I hear a question come up? No. Okay. The LEAD program. So the description of the LEAD program, really seeking to expand an already existing LEAD program by adding an additional community outreach intervention position. This position will connect with community members or connect community members to community-based resources. The initiative will support ongoing work by building infrastructure to support linking community partners with people. And I think we have 3 slides dedicated to our treatment program. So, so next up is our opioid case manager. The program description is that this is really to expand a currently half-time opioid case manager position that's located in the jail. The offer is to make this a full-time position. Restart Studio. So the program description is to sustain Restart Studio program. Restart Studio offers substance use art therapy and recovery support to youth. There are licensed art therapists and addiction counselors providing counseling to youth who have had police contact. Next up, community health worker. So this program is to expand the mental health partners community health worker program by adding an additional FTE community health worker. The program is really to address social determinants of health challenges for priority populations. These CHWs bring resources and services to where community members are. Currently, this program offers individual support through resource navigation, web-based and in-person outreach, psychoeducation, events, and disaster response. The LEAF Mental Wellness and Addiction Recovery Program. So the proposal is to expand Lion's LEAF Mental Wellness and Addiction Recovery Program with additional staff. This program will include substance use disorder counseling, telehealth, in-person groups, medication-assisted treatment coordination, and case and referral management. These services will be available in Lyons and neighboring mountain communities. Pride and Recovery. So the proposal is to sustain out Boulder County's Pride and Recovery programs. Pride and Recovery offers LGBTQ specific peer-led substance use recovery support, including recovery coaching, recovery-focused activities, groups geared towards harm reduction and relapse prevention, as well as access to harm reduction supplies, contingency management, and transportation assistance. And our last set of treatment-based programs, oops, got a duplicate there, Pride and Recovery. So I'll move down to the next one, Adventure Recovery. Expand Adventure Recovery program through a scholarship fund. This program is an outdoor education and mentorship focused program, helping individuals in recovery from substance use disorder and mental health concerns. It does employ certified peer counselors who work on a one-on-one basis, providing counseling and emotional support. Community AccuDetox and AccuWellness. So the proposal is to sustain Natural Highs AccuDetox AccuWellness program. This program is an acupuncture protocol to treat addiction, trauma, and mental health issues. And finally, MAT expansion project. So the proposal is to expand Mental Health Partners MAT program, adding additional staff that will increase access to and engagement with MAT. Other services include therapy, wraparound services such as housing and navigation. The project will expand services to other locations in Boulder County. So I'm going to pause there and see if there are any initial questions, concerns about the treatment programs that I just went through.
Hey, Kelly, it's Susan. I first want to acknowledge again how much work went into this, and just with the team that's leading this, it's just incredible detail. Thank you. As I read through the materials and thinking about the last meeting, I think the thing I'm struggling with a little bit is how are some of these connected? And if we're successful in some areas, is it going to impact other areas? Is it going to impact people moving into other areas and reduce a need in other areas? So I think there's just this larger picture that I feel like I'm missing. I think that's one of my questions. So I don't know if there's a narrative around that, or if you all talked about that piece at all. That's just I think my first question about it.
Yeah, absolutely. So one of the things that we're going to talk about a little bit later is sort of how the Opioid Operations Board is going to be shifting their work in the future, starting with sort of this vision state of what exactly are we trying to create here. I think we mentioned in our first meeting that our strategy in this period of time was largely driven by the fact that we had sort of a short lead time. And so we had a strategy of shovel-ready programs that was sort of driven by that time constraint. And so what the Opioid Operations Group is going to be dedicating themselves to moving forward is developing an entirely different funding strategy that looks at, again, that vision state, what's the continuum we want to create, and how are we being strategic about what we're selecting to build that continuum. And similarly, over time, how and what's our method to revisit what the programs that we are funding to determine, are they having a measurable impact against that vision? And if not, what is our method to maybe sunset funding for some of these programs to allow additional funding to free up for more of those aspirational programs that might better suit that vision? So we're going to talk about that a little bit in our sustainability approach, which is just, how are we going to continue to fold in new programs that really build that broader puzzle, and move away from just sort of this time crunch strategy of shovel ready programs.
That's helpful. Thanks. That was part of my second question, just around evaluation. So I recall that from the last meeting of talking about some evaluation component of these programs. And I think I just want to name that historically we have not always been great about making decisions to stop things when they may not be working. And so I think just as a whole, not just around these dollars, I think us kind of developing that muscle around it. If things aren't working, we do need to be able to let go of them. I know it's hard because sometimes there's people attached. If we're not doing it through attrition, there are staff attached to that. I just, some of this, I just have to say, seeing the big list of this, some of it makes me a little bit nervous without having that more kind of comprehensive view of how this all fits together and some of the dependencies of those. But thanks for answering my questions, Kelly. I appreciate it.
Yeah, absolutely. Are there additional questions about the programs on the treatment list before I move into prevention? I
had my hand up. Yeah, I just wanted to, as we're talking through all of these, I just want to double down on that previous comment and appreciate, Susan, you bringing that up. And I know we talked a little bit about data as well. Like I think these are fine as they move forward, particularly for that shovel readiness that you mentioned, Kelly. I think that's great. But where we're supportive of programs, I think generally we'll all need to sort of see how do we share the data to make sure that we're seeing those impacts. Frankly, some of them across jurisdictions, because where the county may have a program, for example, how do I share out with my council members on council, how that impacts Boulder, right? So I think we got to continue to think about that data sharing and tracking in the future, but get and appreciate the operations team focus on what do we have right now in the short turnaround time.
Yeah, thank you. I think, one of the things that we'll probably touch on in the administrative section of today's agenda is what does it look like to dedicate some funds towards that monitoring and evaluation piece as an administrative component. So we've heard loud and clear from the state and from the example of other settlement regions that they are dedicating some of their settlement funds specifically to that component, to staff or to contractors who are really charged with marrying that that vision that the region has to, the impact of what they're funding. So hearing no additional questions on treatment programs, I will move into the prevention section. So our first program on prevention, go ahead and minimize my menu here again so I can read it. Youth in recovery. So this program is youth in recovery school programs with expand the youth in recovery program in schools with additional staff. Youth in Recovery offers in-school presentations about fentanyl and OUD, naloxone training, and offers peer recovery coaches. Parenting support. So the proposition is to expand the City of Longmont's nurturing parenting class coordinators hours to become full-time. That expanded staff will allow active parenting and community reinforcement in family training or CRAFT to be offered free of charge in English and Spanish. The Substance Use Advisory Group. The proposal is to expand and sustain the Boulder County Substance Use Advisory Group, which sits in Boulder County Community Services. This group brings together professionals, advocates, and those with life experience of addiction to collaborate within the SUD care continuum. Funding will double the hours of current facilitating staff. PSA and social media campaigns. So the proposition is to develop PSA and social media campaigns for youth and other priority populations on opioid-related topics. Slides don't want to advance here. There we go. Additional prevention programs, a harm reduction coordinator. So the proposition or the proposal is to sustain the Boulder County Public Health's harm reduction coordinator position. The community Narcan web. So the proposal is to create a county-wide web of naloxone distribution, education, and training for priority populations across all municipalities. Current infrastructure is supportive for adults to have training and to obtain naloxone, but there's not one for youth. So specific efforts would include youth naloxone access and education, as well as train the trainer models dedicated towards youth population. Harm reduction staff at crisis centers. So the program would expand harm reduction efforts at MHP's crisis center and embed a full-time staff member from the works at the MHP crisis center during key times. Mental Health Partners has been asking for the position, and the works programs sees it as a very pressing need. Overdose prevention vending machines. So the description is to install vending machines with harm reduction supplies in Lafayette and Nederland. Currently, these vending machines don't exist countywide. This would increase access to life-saving naloxone, clean syringes, and other harm reduction supplies. Harm reduction supplies and servicing. The program would expand availability of harm reduction supplies, overdose reversal medication, and syringe disposal locations. This would bolster the works program's supply of naloxone and fentanyl test strips that can be distributed throughout the county. This would also install syringe disposal units in each of the Longmont Housing Authority's sites. I believe that's it for prevention. So I will pause again and see if there's questions or concerns about the list of prevention programs. All right. So our final set of proposed programs fall into the additional areas category in the cost system. So first up, investigation equipment, Celebrate Premium. So this would expand law enforcement's opioid-related interdiction efforts. This tool unlocks password protected cell phones. It also increases the chance of intercepting drug traffickers. investigation equipment, TrueNarc. So this tool would allow or expand law enforcement's opioid-related interdiction efforts. This tool is a portable narcotics analyzer and increases the chance of intercepting drug traffickers and investigating drug-related crimes. And another investigation equipment called Gray Key. And so Gray Key has the ability to unlock and retrieve data specifically from iPhones, increasing the chance of intercepting drug traffickers, into investigating drug-related crimes, and identifying individuals in OD-related cases. And finally, community health worker training. And so the proposal is to expand mental health partners' current community health workers training related to addiction outreach and prevention. This additional staff will ensure sustainability of addiction-based outreach, expertise, and capacity to reach target populations. So that is the end of our shovel-ready list. As promised, just want to pause again and dedicate time, questions from the council or any blocking concerns.
Really, I don't know if you can see hands.
I can't. I see yours now. I just opened up. Some of those slides were so dense, I have to minimize everything just to read them, but now I see some, so I'm not sure who was first.
I think I was. I don't know if you can go back to the previous slide a moment. And so just I guess I'd want to know a little bit more about safeguards for some of this law enforcement work. And not that I don't, supportive of generally the efforts, but I know that I will get questions about how do we know that it is limited, restricted, who else has access to that? How long will that be retained? For what potential other purposes will that be? There seems to me a whole host of questions here that I don't have enough information now to determine whether or not I feel like I can support it.
I may be able to help with some of that.
Mm-hmm.
This is Joe Pelly. It's protected by the Fourth Amendment. It requires a search warrant. That's the protection is constitutional, and there's case law and many years of constitutional layers of protection built into the use of these sort of search engines or search tools.
And I appreciate that, Joe, and certainly as a lawyer myself, right? Like I get the Fourth Amendment, but there are nuances with that, with any of this and what other partners, I mean, I'm sure you were paying attention, but Lord knows I had an earful about just the JTTF agreement that we put forward with our own council, right? So, you know, I still feel like I want to know a little bit more about some of these efforts. And I may be the only person that has these concerns, but I feel like there's more to this before I can give a nod of yes to certainly understand a little bit more of who else would have access, what other purpose could they be used for if we are putting opioid related dollars to it. But certainly for on its face, am supportive. I just need to have more details.
And Nerea, this is Robin, and I want to remind the council, and this was a struggle that I've been having as well, is your vote today is going to agree with the overall area allocations. You are not approving these projects. So we will absolutely make sure when we get to the time to approve specific projects that we would bring that level of detail back to you, as well as any other additional questions that you might have. Does that make sense?
Super helpful, Robin.
And Nerea, the other thing I would offer, you have Boulder police officers embedded in our drug task force, which is where these tools would exist. And I would invite you to come over and meet with them and have them explain to you and show to you how they're used, when they're used, and how that data is stored.
I see additional hands up, but again, I'm not sure the order. So folks know the order, they raise their hand and just want to jump in.
Susan can go ahead.
Yeah, I think to Robin's point, this may not be important, but I think I maybe missed and just need some clarification around the community health worker training versus the community health worker FTE that I think is in the treatment category. And the difference between those.
Yeah, and so I'm not as familiar with this program, but I do know that they were sort of parsed out because the training is a specific evidence-based training, and so there's sort of a set curriculum and sort of a set sort of timeline that staff would be going through that. And then I think that the other one that you mentioned, the actual position, is just sort of like the end piece of that puzzle where they would then take an individual and sort of staff that position of trained CHW. So I know there's other team members on the phone that might be a little bit more familiar with these exact proposals if you want to chime in with any additional details.
Yeah, that would just be my question, is what if you're hiring the staff position to conduct the training, what is the money for the training, unless they have to pay for the training? I'm just not they have to pay to use the training. I just am not clear what that money would be used for. So
Yeah, I'm sorry, I didn't articulate that well, but that is what it would be for. They have to pay for that training. I think it's either a state or a national curriculum and a training that's sort of packaged together. And so that's what the funding would be for. Yeah.
Okay, great, thank you.
Kelly, I can jump in for a second too, that the training is substance use specific training for the team of community health workers. And then the FTE request was to add an additional community health worker to the team. But the training itself was to expand the current team, which I believe was 7 employees, their ability to address substance use concerns in the community.
Great, thank you very much.
So, and then I think my hand is the last hand up, and I had raised my hand earlier and then put it down when Nuria addressed the concern that I have, so I think even though we may have the Fourth Amendment to protect, to put some guardrails on access to the information that Grey Key and Celebrate will make possible. I think there's going to be a lot of resistance in the community to spending money on this, and I'm not saying I'm not going to support it, but I think we are going to have to be very careful about how this is messaged out, and I'm going to need to understand it actually a little bit better about how, once you unlock the phone, what are the constraints. And I know in the world of search warrants and wiretaps and things like that, back in the 80s and 90s when I was doing this kind of stuff, you just had to not listen to the stuff you weren't supposed to listen to. It's a little harder in the digital age. And so I think we are just going to have to be very, very careful with the community to make sure they understand the constraints here. And then just in terms of, what our scope is today, that we're just approving the program areas, as I understand it, we really don't have any other programs that are on the table. And so I think that's why, we're looking at this list, and we'll come back and we'll fine tune it in terms of actual dollars. But I think as we go forward, we should assume that these areas, these programs that we've just been reviewing are going to be the ones that will be funded within each of these areas.
So I wonder if it's helpful to Kelly to go back to the funding pie chart. And so, Kelly, can you remind us about the difference between these 5 areas, and then we're really approving 3 areas. Is that right, or do I have that backwards?
Correct, yeah. So the 5 approved purpose areas were what was originally put out by the Attorney General. And so that was sort of the foundation that our group started developing our recommendations around. And then about a month ago, maybe a little bit longer, the AG put out the online system that we have to put our recommendations into. And that system only had 3 categories, which are the treatment, prevention, and additional use areas. And so what we did is took all of our recommendations and sort of went through that cost system, making sure that they were all reflected in some sort of subcategory within those 3 areas. And we sort of meshed them or married them into the cost categories. So that's why you hear us talk about our approved purpose areas, because that's how we originally developed our recommendations. However, when we move forward, we do need to reflect them as these 3 approved use areas for the cost system.
And do we have a, I don't want to put anyone on the spot, but do we have a newly configured pie chart that would have just the 3 so we can understand how those fund amounts were collapsed, given that that's what we're going to have to approve today?
So I don't have a pie chart. I do have it written down. So I know for our treatment category, the total allocated was $1,035,662. For our prevention category, it's $495,447. And for our other use areas, it's $125,250.
So council members, I don't know if anyone wants to reflect on how those dollars are allocated across the 3 areas. Obviously, the majority of our funding is for treatment, and then prevention, and then the all others. So if anyone would like to comment on those before we vote, or we can also move into what's missing, or do you have what we're calling blocking concerns, like the conversation we just had? There may be blocking concerns for the program specific, but for these resource allocations, just wondering if people have any reflections on how the allocations were divided between the 3 areas, or blocking concerns about the 3 areas. And I know that, Joe, you've put some comments in the chat.
I did make some comments. I understand completely the importance of treatment and the balance of the treatment dollars. I also believe that a portion of this is properly allocated to investigating the distribution of the stuff. So, but I don't have any blocking concerns. I would vote for the allocation as it's laid out today.
Thank you, Joe. Susan, I see you.
Yeah, I don't have any real concerns. I think it's, I think we talked about this last time. I think in the future years here, I think being able to really think about kind of a fiscal model of when we start to see positive outcomes in certain areas, is there possibility for reinvestment into early intervention and prevention? And I know we're not at that place now, but I think just moving forward as we start to think about that. And the only other thing, and I know this is a specific program, but I brought up last time, is just maybe for future needs, would love to put in a parking lot around a flexible pool of flexible funds for families that are going through some of this. I do like the idea of some direct support for families that have dealt with this, but I don't have any concerns otherwise at all. And those weren't even concerns. They were just suggestions for the future.
Got it. Thanks so much. Harold?
I don't have any real concerns. Just kind of going back and echoing, as long as we're disciplined with the program evaluation and really assessing whether we're having success or not, and echoing, I think it's what Susan said about, do we have the ability to say this isn't performing the way we wanted, and we need to go in another direction. So mine's really going to be outcome based and how we assess it and the discipline and holding ourselves accountable to whether or not we're successful in what we're trying to do.
Yeah, absolutely. And we'll be talking about evaluation today as well. Any other reflections or comments?
Robin, I just had a clarification statement. I just want to make sure that I'm on the same page. What we are approving today is the allocation of the dollars into these three particular areas. And we're doing approximately $1 million towards treatment, approximately $500,000 towards prevention, and $125,000 approximately towards additional use areas.
Yeah, you're right, and Kelly, those are the right amounts, I believe. I didn't write them down as she went through them.
Correct, yeah.
Again, I really appreciate everyone's understanding about where we are in this space and time with regard to shovel-ready projects and the work that our staff teams did to, first of all, take an inventory and then really reduce that inventory to, a workable number, and then do the math problem of figuring out the allocations. So we're not done. This is just the very, very beginning. And your comments that you're bringing up today, that's where the real work will happen, is really understanding what are we changing in our community with these investments, and how do we evaluate it? What are the outcomes that we're seeing, and what's the domino effect of those outcomes? And it will have to be iterative learning as we see what's working and what's not working, as well as what we see with the epidemic, right? Because we know that there's been increased use. And so there'll be lots of factors to consider moving forward, and lots of good opportunity for these sorts of discussions. And we really appreciate your engagement.
So I don't have any concerns about these allocations as just reflecting our first year priorities and the input that we received, and the fact that we're trying to focus right now on shovel-ready projects so we can put these funds to work. I think the real interesting discussion will come when we look at what else we need to do that is going to change the landscape. This, yes, we're looking at prevention here and education, but with the crisis that we have right now, treatment, harm reduction is what we can do immediately with shovel-ready projects, and probably most effectively. But then as we look over the longer term and are able to consider some other kinds of projects, I hope that we really do think about, backing way up into what makes a person vulnerable to addiction or to, starting to use, and what are the signals in society? What are the supports that they're lacking? How do we work in conjunction with the behavioral health treatment providers, because so often it's co-occurring, and you can't address the substance use disorder without also addressing the behavioral health problems. And so I think I'm real excited to get to the next phase of the conversation, also to see how we can really go beyond addressing the immediate needs and the constraints of shovel-ready projects.
Thank you, Claire. Do you want to call for a vote? And
okay.
I'm not sure how we do it on Zoom, if people raise their thumb, or
Well, I think what we should do, yeah, I guess it's my job to actually bring us to that vote that we'll need to move forward. I think the easiest way is for people to use the hand raise function to indicate their support, and then we can just announce the results of that. So if all those in support, please do use the raise hands function, indicate your support. And
Claire, Judge Baki here. I'll just do a thumbs up on that.
okay, thank you, Judge Baki. So I see 1, 2, 3, 4, 5, 6, 7, 8, 9, and then with Judge Baki, we have 10, and I think that is all of the voting members. So we do have unanimous support, and thank you very much.
Kelly, do you want to move the slide forward?
Yes, I was just gonna say, looks like we're ready to move ahead here. So we did want to spend a little bit of time today talking about what our process looks like moving forward, a lot of which we've already sort of dipped our toe into by talking about what we want, what we hope to see, and what the process looks like moving forward. We know that we need to first approve our projects. We know we need to talk about sustainability and what that looks like, how it's married to our sort of grand vision of what we want to accomplish. And some of that will be reflective in some of our shifts in the work of the opioid operations group. So the first thing that we know we need to figure out next, and really want to kind of put in front of the council to hear your thoughts and recommendations, what process does the council recommend to approve project level fund allocations? So we know a few of these have already come up today in terms of, certain projects needing a little bit more information, but really just want to hear additional thoughts on, where and when the council would feel comfortable process-wise approving that project level fund allocation. I will say also that we have. Sorry, I started to talk over someone. I'm not sure who was talking.
Well, this is Joe Pelly, the sheriff. I was going to suggest, it seemed the questions or the concerns did center around the enforcement piece. And I would be willing to have a group of folks present, including county attorney and Nico, the commander of the unit, on process and to answer questions, that type of thing, if that would be helpful.
I think that's a great idea, Joe. And I wonder if the council members want to begin thinking about, are there other programs that they also have concerns about or more questions that they'd like more in detail staff presentations on when we get there?
Yeah, if we could organize staff presentations around those things, that would, and we may be able to get through the question and answer sort of thing after a presentation and make a decision. Some of these things too, I want to point out, like the MAP program at the jail is now statutory, it's required. So we're mandated to have that, and I'm not sure that was reflected in the notes, but I think that's a great piece of information for people to have as well.
Yeah. So Miranda, I think your hand is up from the vote. Then I think if that's correct, and then Claire, I think you were next, and then Harold.
Yeah, thanks. Just in terms of process for recommending the project level fund allocations, I don't think, just here today, I have questions about any of the specific areas, but I think in general, what I'm going to want to know, and maybe somebody is just going to be able to address this, it can go in a matrix or something, is what the track record is of the group, the organization that is going to receive the funding. I know we've talked a lot about the data after the funding and how we're going to look at that, but maybe some history on the recipient, what their track record is, longevity, what their practices are on being fidelity, being faithful to the evidence, that sort of thing, just to, know that we are actually funding evidence-based programs and that there is a high degree of fidelity on that.
Thank you, Claire. Harold?
Similar to what Claire said, I think I just need more depth in the information to really understand what questions I may have, and it gets to the so what. So we're asking for this, and I'll use the City of Longmont programs. I understand and have more depth of knowledge into it, but if I didn't, my question would be, so what do you want to do? What do you want to accomplish with this? What are you, how many clients are you going to add to the mix? I just need more depth.
And can I just clarify, so Harold, when you say more depth, are you primarily focusing on like the intended outcome of each of the programs? That's what I'm sort of, or is that just one element of additional?
That's just one element. So, I guess the best example is when I go through my internal budget reviews, I'm asking what's the outcome? What are you already doing? How many people are you serving? Is this an incremental impact? Are we having a tangible impact in terms of what we're doing? But I just don't know what questions to ask because the information is limited.
So Kelly, I'm wondering if the operations group, we have not done an RFP process. So it's not like people put in a proposal with that level of detail. Has the operations group talked about, will that be part of the process? Or how will we get this level of detail for the ROC to be able to vote? It's sort of like a funding board, right?
Yeah, I don't think that we've talked specifically about those particular pieces, but we have held space and recognized that there might be some additional content about the programs that the council would want to see. And so I think that we are prepared to, we're in contact obviously with all of the program administrators and folks that put forward their proposals. And so, throughout this process, we have asked for a little bit more meat and depth about details about their programs. And I think it's easily something that we can go back and, ask these more specific questions now that we know exactly what council members would feel more comfortable knowing to advance project level funding recommendations.
And it sounds like, Harold, you would like to see that depth on, one way would be to say which projects would you like to see more depth on. And Harold, in my understanding for you and probably for many others, it would be helpful to have that across the board. Is that correct?
Yeah, I think so. It's yeah, because you don't know what to ask unless you understand the programs, and I don't think I have the depth of understanding of programs that are outside of really what's in my organization. And so I think that would be really good.
Okay.
So Robin, I'm thinking that since in some way we're going to have to develop a contract with anything that we fund, we could come up with a standard kind of proposal format and budget template and have organizations that have requested funding to fill that out so that we've got a little bit more depth. And then those can be then reviewed by ROC members in preparation for making final decisions about what the dollar amounts would be.
And maybe at a ROC meeting, go through those documents as presentations.
Yeah.
Previous.
And just so folks know in terms of the timeline here, so given that we've approved the general funding allocation amounts, we can now submit that information to the state, but the state's going to take about a month, maybe a little bit longer to actually approve. So we've got time in between our submission and actual access to the funds, which would allow us to go through these projects a little bit more in detail, to examine them and make decisions about, does the funding change? Do the expectations that we need to see change? Do they get pulled? Do we add more money to them? So there's a variety of recommendations that the ROC members can make related to a given proposal.
Maria, I see your hand up.
Yeah, I just wanted to concur with Harold that a little more depth, and I don't mean a deep dive, right? Because we don't want to make this too onerous to what's happening. And would be helpful, and it will differ between who's asking for money. So for example, to use you, Harold, I hope you don't mind as an example, right? Like if you've got that one extra bilingual coordinator, what have you been your outcomes generally before, and how would that increase, right? Is just helpful without having to know all the details of everything there. And if it were somebody new, I think to Claire's comment earlier, we'd want to make sure if it's somebody who's getting new funding, that's a new organization, like, you know, how I wouldn't ask this of a city, but I might ask that of a new nonprofit that is just formed, like, you know, how are you set up for success? Like, what are some of perhaps the details of, are you a successful organization as we move forward? Do we know that our money is going to be well spent? And that's a slightly different question that I would have to a city. So some of the questions may be nuanced depending on who's asking for funding. But I do appreciate the idea of having just a little bit more detail to know that just have a little bit more certainty that the money we're spending is actually, or it's going to at least drive towards, it doesn't mean it all has to be successful, right? Because we'll learn if it's not through the evaluation process. We'll learn if it's not, and we'll stop funding it. But at least that it is set up for success in the way that we're thinking about these projects.
Thank you. Kelly, correct me if I'm wrong, but I think the majority of the projects, the shovel-ready projects, are projects that are already happening and are either vulnerable to losing funding, or they want to expand with additional funding. Is that correct?
Yeah, that's correct.
Yeah. And I think you put some of that in the recommendations. I thought that was super useful, as well as Joe's earlier comment about what things are statutorily required or not, because then that kind of makes a different kind of decision. So those kind of, I think, nuances would be really helpful to me.
Yeah, thank you.
Robin, I had my hand up again, and I think, you know, for me, it's a relatively simple concept, but it's who, what, when, where, why, and then what's the impact or the significance that I tend to look for, because that's a quick and dirty way to get it. And then I think it's important to understand that, and I know we're going to talk about program evaluation later, but you almost have to understand those types of things on the front end to then really be able to have a really good program evaluation, or you end up fighting about what you're supposed to, what we all thought we were going to accomplish when it's not clear.
That's correct. That's a good point. Thank you. So I'm watching our time, and I think we'll take the staff will take this back to the operations board and figure out the process to address all of these ideas. Joe, I see your hand up. Joe, I think you're on mute if you're talking.
Yeah, sorry about that. Would you please include Curtis Johnson on this future invitation so that he can get oriented to what we're doing and then continue that work next year?
You bet. And we'll send him links to the last webinar as well as this one, so he can view them if he wakes up at 2 in the morning and can't sleep.
Awesome, thanks.
Susan has a question in the chat. I do believe these dollars will go through the county's procurement process.
And Lexi's got a question too.
Sorry.
Thanks. I know that there was a question on the table about whether administrative support and costs would be provided, and I don't know if that needed to be part of our discussion today or not. Or if we want to talk about the process for determining that.
Yeah, and we do have that in the last section of our agenda today. We do know that up to 10% of our allocation is allowable for administrative costs. We just got confirmation on that from the state today.
And Kelly, would that be per project or overall?
It's overall.
All right. So in our last 20 minutes, we have a few agenda items. We've talked a little bit about, how we're going to determine what will sustain versus what will drop off and planning for new investments. Kelly, did you have other more need for that subject area to go more deeply in?
No, not really. We just wanted to mention that we had heard that concern come through loud and clear, both in our September BCROC and then also today. And so we did have a preliminary approach to broach the subject with our operations group on Monday. We've done some work to already parse through our shovel-ready programs and figure out, are any of them just a one-time funding need versus which are ongoing? Most of them are ongoing funding needs. And so the conversation shifts to what we've talked about today, which is, how are we making sure that we're measuring, monitoring programs against our intended impact to ensure that we have a mechanism in place to sunset programs and bring on additional programs that really align with that vision. And so the last question was really just, do council members have any additional concerns about sustainability that they would want to have the operations group sort of chew on that at that Monday meeting? And recognizing a lot have already come up in the course of our discussion.
Harold, I see your hand up.
Yeah, I'm probably arguing against myself if I'm wearing my city manager hat on this one. But I think what is the plan? Because I almost see this as seed money in some ways to bring almost a push into having more of an impact. But in terms of municipalities, and this is what I'm going to look at internally is. How long do we rely on the ongoing funding, and when is it our responsibility to then start trying to remove that need for the ongoing funding through our own budget processes so we can open up the door for other opportunities and ideas in the future? And that's how we treat one-time or term limited positions. We start that way to see if it works. If it works, then we start figuring out how do we bring that back within our own budgets so that we can create capacity for other things. And I don't know how you build that into it, but I think it's an important question to ask a lot of these groups.
Yeah, I think this is going to be the key question that we're going to have on every agenda as the programs evolve. Susan and then Lexi.
Yeah, I think this gets a little bit to what Commissioner Levy was talking about, but I think part of the sustainability for me is being able to knit together the behavioral health roadmap and plan moving forward.
Hi,
what?
I'm calling from Nationwide for the roof inspection today.
Yeah.
Yes, ma'am, I'm at your house. It might be anyone else.
Oh,
I was understanding you were coming at 3 or after.
Judge Baki, you need to we're hearing your conversation.
Will do. Give me a second. I'm driving.
Susan, do you want to go ahead?
Yeah, sure, thanks. So I think just that knitting together of the two plans to really look at those comprehensively and where we can leverage dollars. And I think just, I know this will happen, but full transparency on the front end with people that we are funding, that this, there will be an ongoing evaluation, and we'll be looking at really what has positive outcomes and the need moving forward. And there's no kind of guarantee of ongoing funding. I know that sounds obvious, but I think it's it's worth stating again, just that it's an important message to send to the programs that we're funding.
Absolutely. Thank you. Lexi?
Yeah, it's a similar comment to Susan's in terms of just when we think about the evaluation, not just thinking about evaluating the individual investments, but understanding how the collection of investments contribute to each other and relate to each other and reinforce each other. So it's really just like, how do these investments fit within that bigger picture? Because I think what we don't want to do is to make a decision to not continue something without the unintended consequence of later recognizing that it actually had a domino effect of affecting a number of other spaces.
And since we're talking about evaluation, Jim, I don't know if you want to get on and talk. We've had some preliminary conversations about evaluation, and I think it relates to the admin dollars as well. Do you want to make any comments about how we're going to approach that?
Well, I think there are probably two phases of looking at the evaluation. The first is, given that, as Susan relayed, these are kind of a scattershot of projects that don't necessarily come to form a whole. We're going to have to look at what we do evaluation-wise on a more program-by-program basis. And then moving forward, as we think more strategically about how future dollars are used, how do we create a more comprehensive, targeted, or focused evaluation that's really looking at impacts to the community over time based on a more strategic approach to the investments. So what we would probably do is come up with an RFP to figure out what is it that we're requesting for evaluation services, and then put that out for bid, and then come to this group or to the operations group to explore those proposals, and then fund somebody to do the evaluation.
I think Jim froze at the end there.
Yeah, I don't know if it was just me or if he froze for everybody. I want to move us along because I want to be respectful of people's time on the.
Absolutely. And this is the last thing, and we've already touched on it, so I'll just go ahead and hand over to Robin. This is just what's next for the operations group, a lot of which has come up in the course of today's conversation. Broader funding strategy, really being conscious and intentional about monitoring the effectiveness of the programs, and then additional voice fusing in. That's kind of pinging off of our discussion in September of who needs to additionally be at the table. I did have one question, but I think that, for the sake of time, I might just pass off to Robin here to close us out with the admin items. Thank you.
All right. And Jim texted me and said he lost his power on this beautiful fall day. We are standing up a website for this work that you are all doing. Barb Halpin, I don't know if you want to put the website location in the chat, if it's ready for people to see live. But I just wanted to point that out. And I want to support us having an easy way of setting up ongoing meetings. We had a question from our last meeting about the cadence of the meetings. I heard back from a few people who said every other month made sense. And I'm wondering, though, given the conversation today about wanting more project information, if we set another meeting for a month from now, which will be challenging as we go into the winter holidays, or if we want to take 2 months to prepare for the presentations of the specific project, but then that's going to get us into December scheduling challenges as well. So anybody have the right answer to that question? We could certainly
I have a question. So how many presentations or project presentations do you expect to request, and who's going to make the decision about who to invite? I think that's going to determine cadence and the need for more meetings potentially.
Yeah, I think that's a really good question, Joe. And I'm wondering, Kelly, if you could add that to your operations meeting on Monday. I heard sort of, there's different groups. So there are some programs that have been in the community for a while and we know about them. And we might, have a template of questions for future details, or for some of the, the investigative, that might be more educational presentations. And then there's going to be new agencies or new programs that we might need a different type of presentation on. Kelly, what's the number of total projects? Do you know that off the top of your head?
Ooh, that's a great question. And I hope I don't fumble it. I think it's 26, but I know Lisa or Tucker, if you're able to chime in with that grand total project number we came to.
$25.
Thank you.
Yeah, I don't think we'll survive 25 presentations. So there has to be somebody, some group responsible for determining who's going to make presentations, and I would suggest maybe like some of the longtime existing programs may not require a presentation as much as new nonprofits, or the questions around the enforcement piece that Naria and Claire had. Just don't know how you get there, but 25 presentations in 2 minutes is not going to work.
No, I hear you, Joe, and I wonder, Harold, I see your hand up, but if I may just make a suggestion, if the staff and the operations group sort of vets this, how this will work, and we can circle back out to the ROC via email and get your sign off on our proposal about how we're going to manage this. Harold, and I don't want to go. I'm sorry, go ahead.
I'm sorry. I appreciate, but I think it's absolutely critical that staff work get done to cull that down and narrow it down.
Okay. So rather than getting into the details about how this is going to work, I would just like to ask the board if they're okay with the staff coming up with a recommendation how to manage this, given that we've taken in your comments and concerns, and then we'll move forward. So in terms of the meeting, I think we're just going to have to do another doodle poll and see what we come up with. And for this meeting and the last meeting, Claire, we started with your schedule, recognizing that everybody's schedules are busy, but at least it gives us a starting point. Susan, did you have something? And then Joe, I'll call on you again.
Yeah, I personally really like what some of the evidence-based clearinghouses use as it's a very summarized, and I think to Harold's point of kind of the who does it serve, what does it do, what have the outcomes been, what's the anticipated outcome, those kind of things. That would be fine from my perspective. I did want to go back to what I think Kelly had on a previous slide around the operations board. I could be wrong, but I think it was about, additional representation, because I think what I'm seeing is that it's a pretty different skill set for how you all are going to be moving forward and the types of conversation that you're going to be having, or the goals that you have for that group. So it sounds like maybe we can connect, or you all can connect with us on the staff support that you might need, the different skill sets you're looking for, and we can work on trying to create capacity within our departments.
Okay. Joe, do you have your hand up again?
Yeah, I've been communicating with Nico and the district attorney's office, and they'll have something ready for the next meeting when you determine to answer Nerea and Claire's questions.
Great. All right. So we have 5 minutes. Claire, I'll turn the meeting back over to you for any closing comments and closure of the meeting.
Yeah, thanks, Robin. Thanks to everybody for your participation here. And we stuck to our task and we got it done. And I do appreciate everybody's questions and comments. And I think we're really coming together on this. But I guess I would invite if anybody else has anything they feel they need to say before we end this meeting. I would invite that. And then I have a question that I meant to ask earlier. And Robin, when you did your introduction, and you said we were not taking public comment at this meeting, but could you lay out what the opportunities for public input will be as we go down the road? Just do that quickly, and then I would invite other people if they have any last minute comments they'd like to make to go ahead and participate.
I think it's a great question, Claire, and I don't know the answer to it, frankly. Kelly, I don't know if the operations group or the staff team have had this conversation.
Yeah, we have. So I think this is another one of those things that we sort of, unfortunately, I don't want to say put aside, but we did sort of make a lean avenue for community input and because of the shovel ready approach. And so out of respect for wanting to kind of go back and fuse that in from the process moving forward, we're looking at, and this will be part of our conversation in the operations group on the 24th, what is our best practice for, bringing together more voices for that grand vision forming state. And then also what's our mechanism for fusing in community input on an ongoing basis. So actually just got off of a meeting with Jamie Feld, who works closely on this process to get a little bit more of an understanding of best practices from some of the settlement regions that actually did begin their approach from sort of that large scale community convening and then sort of whittled that down into their strategy. So we went a little bit of an opposite approach, but it's very much at the top of mind for the operations group as we move into this next iteration that's more strategic or more strategy focused.
Okay, thanks for addressing that. I think the public is interested in this, and just knowing that there will be an opportunity and at what level, where will it be? And I recognize that we do have the operations board and we're working with the community group as well already, but just general members of the public, I'm sure, are very interested in what we're doing. Yeah, Lexi, and then really just anybody else, just go ahead and jump in. And we've got about 2 minutes.
Yeah, just appreciate the question about how does community voice factor its way into this process, and just recognizing that in some ways it feels like this opioids work is part of the broader regional behavioral health strategy. And so those may be opportunities for us to create focused conversations that still contribute to the broader conversation and help make connections for folks.
Okay. All right. Well, this work, it's part of healing. And I think there's just a tremendous feeling of trauma in our community, and it's coming from many, many sources. And the addiction crisis is one of them, and it's near the top of the list. If it's not at the top of the list, and our work is important. I'm honored to just be here on these screens with all of you and get to watch this great work happen. And I look forward to getting these dollars out into the community and seeing them go to work. So thanks, everybody. And we will be sending a doodle poll out to get the next meeting scheduled. Okay, bye-bye. Thanks.
Thanks, everyone.
Thank you.